Pancreatic pseudocyst. Pseudo means false cyst. So, what is the pathology? The pathology of pancreatic pseudocyst. We have nature. What nature is it? This pseudocyst is a collection of pancreatic secretion and inflammatory exudate. We know that cyst means it has secretion and exudate inside it. So, within a lining of inflammatory tissue rather than a true epithelium. So, this pseudocyst does not have an epithelium, it has a lining of inflammatory tissue. And this is why it's called pseudocyst, false cyst. It is not true. A true cyst has a true epithelium. A false cyst does not have. So, what is the cause? What exactly causes this pancreatic pseudocyst? So, we have acute pancreatitis. Okay, acute. It's the commonest cause. Acute pancreatitis will cause pancreatic pseudocyst, the false cyst. So, the pseudocyst develops in 10% of cases, very small number, right? The cyst usually develops 2 to 3 weeks after the acute attack. So, for suppose you had pancreatic pseudocyst, and after 2 or 3 attacks of, you had acute pancreatitis, and after 2 to 3 weeks of acute pancreatitis, you will have pancreatic pseudocyst. Not all of the patients, only 10%. And the second cause of the pseudocyst is pancreatic trauma. So, if there is trauma to pancreas, it might form pancreatic pseudocyst. Or maybe the third cause is chronic pancreatitis, which can also cause pancreatic pseudocyst. So, see, we have both of the types of pancreatitis, acute and chronic, both will cause pancreatic pseudocyst. This cyst is commonly located in the lesser sac between the pancreas and the stomach. So, between our stomach and the pancreas, we have a sac, lesser sac. And in this sac, you will find this pseudocyst. Possible complications of this pancreatic pseudocyst are infection, like any cyst, they cause infection, or hemorrhage, like rupture. So, rupture, like, and then hemorrhage, and also rupture, yeah. What's the clinical feature of this pancreatic pseudocyst? Like symptoms and signs. It is very small in size, it is a small pseudocyst, and it has no pain. So, how will you know that you have it? It is small, it has no pain. You will only actually know this if you do ultrasonography. Only ultrasound will show this. What if the size is actually very big? What if the pseudocyst is big in size, a larger one? A larger one will definitely cause you discomfort or manifest clinically as an upper abdominal swelling. See, pancreas is located in the upper abdomen, so upper abdominal swelling that sometimes reach the size of a melon. They're talking about watermelon. So this becomes so big, like really large one, that they're comparing to a size of watermelon. So first it has no sign, okay, and then later on it looks like really big. Do you understand? It can be small and large, it depends.